Another day, another story. Colorectal cancer rates are rapidly rising among adults in their 20s, 30s, and 40s, and the most common warning sign for the disease is passing blood in the stool, according to a new scientific review. Rectal bleeding is associated with a 5-fold increased risk of colorectal cancer, according to the new analysis, which looked at 81 studies that included nearly 25 million adults under 50 from around the world. Abdominal pain, changes in bowel habits, and anemia are other common warning signs of the disease and should not be ignored, said the researchers who published the paper on Thursday in the journal JAMA Network Open. Welcome to Tabo Eminent Channel. Why it matters. Colon and rectal cancer rates have risen among younger adults as rates have declined among older people, who are far more likely to get colonoscopies that can catch cancers and precancerous lesions called polyps. But though millennials born around 1990 are at almost twice the risk of colon cancer compared with people born in the 1950s, and have a risk of rectal cancer that is 4 times as high, young people without a strong family history of colon cancer aren't eligible for colonoscopies until the age of 45. Doctors may also miss the warning signs. Anecdotal evidence suggests that because physicians are less likely to suspect malignancies in younger people, they may attribute a symptom like rectal bleeding to a benign condition like hemorrhoids rather than cancer, said Joshua Dem, a cancer epidemiologist at the University of California, San Diego, and one of the paper's lead authors. From the time younger adults first go to a caregiver with a complaint about a symptom until they receive a diagnosis can take 4 to 6 months on average, the analysis found. Because the diagnosis is often delayed, younger adults tend to have more advanced disease that is harder to treat. We need to facilitate early detection, and one way is identifying these red flags, Dr. Dem said. What we don't know. The causal factors driving the rise in colon and rectal cancers in younger adults were not addressed in the new analysis and are not well understood. Colorectal cancer has long been associated with obesity, smoking, a sedentary lifestyle, high alcohol intake, and diets that are rich in red meat, processed food, and sugary drinks. New research exploring the rapid rise in colorectal cancer in younger adults is examining other possible causes, including environmental exposures, changes in gut bacteria, and the use of some medications, such as antibiotics. Historically, colon cancer has been more common in older adults, typically those over 50. However, over the past few decades, there has been a noticeable increase in the incidence of colon cancer among people under 50. Several factors contribute to this shift. 1. Lifestyle. Changes, dietary habits, obesity, sedentary lifestyles, and increased consumption of processed foods are associated with higher risks of developing colon cancer. 2. Genetics and family history. Younger adults with a family history of colorectal cancer or inherited conditions like Lynch syndrome or familial adenomatous polyposis, FAP, are at higher risk. 3. Awareness and screening. There is growing awareness about the importance of early screening, even for younger individuals, especially those with risk factors. 4. Environmental factors. Changes in environmental exposures over the years could play a role, though these factors are less well understood. The American Cancer Society and other health organizations have responded to these trends by updating screening guidelines. For instance, the recommended age to start regular screening for colorectal cancer has been lowered from 50 to 45 for individuals at average risk. Historical perspective and epidemiological shift. For decades, colon cancer was predominantly seen as a disease of aging. Most cases were diagnosed in individuals over 50, leading to screening recommendations targeting this age group. However, starting in the early 2000s, researchers began to notice a disturbing trend. While overall rates of colon cancer were declining, likely due to improved screening and preventive measures, the rates among adults younger than 50 were increasing. This shift has been observed in many countries, including the United States, Canada, Australia, and several European nations. Statistical evidence. Studies show a significant rise in colon cancer incidence among younger adults. For instance, research published in the Journal of the National Cancer Institute in 2017 found that between 1994 and 2014, the incidence of colon cancer increased by 1.2% per year in people aged 20 to 39, and by 0.51% per year in those aged 40 to 54. This increase contrasts sharply with the decline in incidence among older adults. Possible contributing factors. Diet and lifestyle. Modern dietary habits, particularly in Western countries, have shifted towards higher consumption of processed and red meats, refined sugars, and low-fiber intake. These dietary patterns are associated with increased colorectal cancer risk. Additionally, sedentary lifestyles, obesity, and metabolic syndrome are significant risk factors. Microbiome changes. Emerging research suggests that alterations in the gut microbiome may play a role in the development of colon cancer. Factors like antibiotic use, diet, and overall lifestyle can influence the microbiome, potentially increasing cancer risk. Genetics. While genetic predispositions have always been a risk factor, they may not fully explain the recent trends. However, individuals with hereditary conditions like Lynch syndrome and familial adenomatous polyposis, FAPE, are at particularly high risk and are often diagnosed at younger ages. Environmental factors. Exposure to certain environmental toxins and pollutants has also been hypothesized as a contributing factor, although this area requires more research for definitive conclusions. Impact and response. The increasing incidence of colon cancer among younger adults has significant implications for public health. Revised screening guidelines. In response to the growing evidence, the American Cancer Society updated its guidelines in 2018, recommending that individuals at average risk begin colorectal cancer screening at age 45 instead of 50. This change aims to detect cancer earlier in younger populations. Awareness campaigns. There has been a concerted effort to raise awareness about the risks of colon cancer in younger adults. Educational campaigns emphasize the importance of recognizing symptoms, such as changes in bowel habits, blood in stool, and unexplained weight loss, and seeking medical advice promptly. Research and funding. Increased funding and research efforts are focused on understanding the specific factors driving the rise in younger-onset colon cancer. This includes studies on genetic mutations, lifestyle factors, and the role of the microbiome. Personal stories and advocacy. Personal stories of young individuals diagnosed with colon cancer have played a crucial role in advocacy and awareness. Many young survivors and their families have become vocal advocates for early screening and research funding. Their stories highlight the importance of not dismissing symptoms based on age and have helped destigmatize the conversation around colorectal health. Innovative diagnostic tools. Advancements in diagnostic tools, such as non-invasive stool tests and improved imaging technologies, are making it easier to detect colon cancer early. These tools are particularly beneficial for younger individuals who may be hesitant to undergo traditional colonoscopy. Future directions and hope. Research into prevention and treatment. Ongoing research is exploring new prevention strategies, including dietary modifications and chemoprevention, the use of drugs to prevent cancer. Additionally, immunotherapy and targeted therapies offer promising new treatment options for patients with specific genetic profiles. Increased funding and collaboration. The rise in young-onset colon cancer has led to increased funding for research and greater collaboration among scientists, healthcare providers, and advocacy groups. This collaborative approach is crucial for developing effective prevention, detection, and treatment strategies. Conclusion. The rise of colon cancer in younger adults represents a significant shift in the epidemiology of the disease. It underscores the need for updated public health strategies, increased awareness, and further research to uncover the underlying causes. By adapting screening guidelines and promoting preventive measures, the medical community aims to address this alarming trend and improve outcomes for younger patients. Thanks for watching. Request you to subscribe the channel.